Okay, good morning, everybody, and welcome to the final Impact of Scrutiny Advisory Committee before the election in May. My name is Ian Ray. I'm the chairman of the committee. Before we start, because we're having to do this meeting on the internet, I have to make an announcement due to the COVID-19 restrictions, and then we'll start the meeting proper. Because of the coronavirus pandemic, the Council is holding this meeting electronically in accordance with relevant regulations. Members of the public may also attend this meeting in an electronic capacity, and there is a link on the Council's website for them to do so. Members of the meeting are asked to keep their microphones switched off until called to speak, and to switch their microphones off once they have finished speaking. Members may leave their cameras left on throughout the meeting, but they should be switched off if and when you're speaking, but you can leave them on or switch them off as you wish when you're not speaking. If you wish to speak, can I ask members to use the raise hand function, and that will enable me to identify who wants to speak. At the end of the debate on each item of business, there will be a vote. I will ask you to vote verbally for, against or abstain, and I'll ask you in turn to go through that. And I will declare the result after each vote. The Democratic Services Officer will confirm the outcome of the vote in chat, so that both verbally and in chat it will be visible what the outcome was. There are officers present and they will be following the same protocols. If the meeting lasts more than 2 hours, then we'll have a 15-minute break after 2 hours. And if you wish another break for any reason, then they can indicate to us that they wish to do so. Finally, I would remind members that they are required to declare any interests that might be on with any items on the agenda, and they should do that according to the recommendations for pecuniary and disclosable and declarable interests as identified in the agenda. Thank you. We have no substitutions and no apologies. I'll go through now each member in turn in alphabetical order and ask them if they will introduce themselves. Starting with Lynn Chesterman.
Good morning, Chair. Thank you. I'm Lynn Chesterman. I represent Welwyn Garden City South Division for the Labour Party.
Thank you. Nigel Quinton.
He's late.
I'm here. It's all right.
Oh.
Just struggling with IT at the moment. My laptop wasn't working, so I'm on the iPad. Yes, so Nigel Quinton. I'm the Lib Dem councillor for Hansard and Pear Tree in Welwyn Garden City, adjacent to Lynn.
Okay. Thank you. And Richard Smith.
Hello, Richard Smith. I represent the Welwyn Division in Welwyn Garden City. And that completes the three of us from Welwyn Hatfield.
Thank you. And Jane West.
Good morning, I'm Jane West and I represent the Bushy North Division of the Conservative Party.
Thank you very much. So we'll now go into the business proper. The first thing we have to do is to confirm the minutes of the Impact of Scrutiny Committee, which met on the 20th of November. Can we all agree those are a correct record? Again, perhaps if you can each in turn say yes or no or abstain on that.
Agreed.
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 Okay, thank you. So that's now agreed. So we'll move into the debate on the first topic, but I just want to remind people that the debate is for members of the ISAC only, and also comments in chat are for ISAC members only. So officers who are present as witnesses, please don't get involved in the debate. We'll ask you to speak, but we don't require you to perform part of the debate. And I'd also like to remind members that members of the committee, that is, that this is the purpose of this committee is quite narrow. It's to reassure ourselves that the recommendations of the various topic groups have been carried through as requested. Our purpose is not to repeat the topic group discussion and go over those issues again. We simply want to be assured that the tasks which they were asked to carry out have been carried out to our satisfaction. Okay, I will now go to the first item, which is the Hertfordshire Safeguarding Adult Board topic group. We have present Mary Moroney, who's the business manager for the Safeguarding Board, and Liz Hanlon, who's the chair of the Safeguarding Board. We also have Jonathan Kay present, who was the chairman of the of that topic group. I'm not sure if we have Richard Roberts present, who's the executive member. But I'll start by asking, I think, Liz Hanlon, if you'd like to say a few introductory words about the about this topic group and the recommendations and how progress has been made. Thank you.
Good morning, everybody, and thank you very much for welcoming us here this morning. Myself and Mary are going to do a double act, so I'll introduce and do a bit of background, and then Mary will fill in if there's anything that I've forgotten, if that's okay. So just to do a bit of a recap, that the Hertfordshire Safeguarding Adults Board came into fruition following the Care Act in 2014. And over those when we did the scrutiny over the last 5 years, it was the purpose of the scrutiny was to look at the impact of the board and the way the board had developed over the last 5 years. So the board is made up of multi-agencies. It's split. We have a statutory partnership board, which drives the strategic business, and the partnership board is made up of the police, health, and Herts County Council adult care services. So that's the statutory board that, like I say, drive forward the business of the board. We then have the main Hertfordshire Safeguarding Adult Board, and the Care Act does not explicitly say who should be a member of the Safeguarding Adults Board. In Hertfordshire, we have a very broad membership. And we have members from all the health, so we have the acute trusts, we have CCGs, so we have a broad membership of that. We have East Anglia service, ambulance. We have the prison service on occasion where relevant. We have Health Watch, public health. So it's very broad, and the purpose of the board is to make sure that all partner agencies within Hertfordshire are making sure that they are doing everything they can to support those adults within the society that are vulnerable, that have care and support needs, that need additional health from agencies, and that we work those as individual agencies but also in a multi-agency forum. And I'm sorry, I forgot to mention that we have a chief executive from one of the districts that covers all 10 districts as the board member. So the board meets 4 times a year. At the beginning of the board in 2014, we met 6 times a year. The executive meeting also was 6 times a year. The reason we met more than other boards and more than the children's board was that we identified that we had a significant amount of work that needed to take place. So because the board was only just developing, we needed to look at the right membership of the board, who the subgroups were. We have 5 subgroups that lead and do actually do the work of the board. So we met on 6 occasions, and we've now reduced that to 4 times a year where we hold board meetings. We also have statutory partners meetings 4 times a year. And we also hold a joint children and adults safeguarding board. We introduced that about 3 years ago. And the purpose of doing a joint board is that we identified that there was a lot of learning, there was a lot of work that crossed over between children's and adults. So domestic abuse, lead review, modern slavery, prevent. So the big topics that went across both the boards we felt was of importance enough to bring the boards together to have one board a year. So we do that in March. The role of myself as the chair is to assure myself that all the agencies are doing what they should be doing in relation to safeguarding adults. And some of the ways I do that is in relation to safeguarding adult reviews, which we carry out by the board, and that's when an adult with care and support needs either dies or is seriously injured, and we pull together a multi-agency review to look at the learnings that's come out of that death, and then those reviews and learnings and lessons are implemented by the board. We also carry out our own board's internal scrutiny, so we have boards, partnership agencies present to the boards on different topics, and as you'll see in the output of the scrutiny from 1920, a lot of the information on that report is as a result of boards and agencies presenting to the board and providing us with evidence in relation to completing the actions and tasks that they should be completing. So we assure ourselves that agencies are doing what they should be doing. The scrutiny in 1920, as I've already mentioned, was to look at the impact that the board had had over the last 5 years and the changes that had taken place of the board, and whether there was any identified issues that the scrutiny panel felt that the board needed to continue doing, or that they felt needed further development. I don't know if Mary wanted to come in for that, or Jonathan at all, to give a bit more of an update. Or are you happy with that?
That's fine for me. I don't know if Mary wants to contribute.
No, that's fine. Thank you, Liz. I think you covered everything.
OK, fine. So if I go through the recommendations that were presented us by the scrutiny panel. So part of the scrutiny was myself, Mary's the board manager, and Mary covers both the children and adults board. So for us, that's really important because Mary can then bring about the learnings from the children's board into the adults, but also the adults board into the children's. And a piece of work that we've recently commissioned is to do with transition of care, so transition of children that were looked after children transitioning into adulthood, and we had a safeguarding adult review where unfortunately a young gentleman died who was transitioning from children into adult services. So we find it really important that Mary covers both boards so that we can have learning across both the boards. So out of the scrutiny panel in 1920, we had 3 recommendations which myself, Mary and the board have worked on and have completed, which have gone out to yourself. So the first recommendation was in relation to the safeguarding team, which was the adult care services safeguarding team. And it was to look at the referral mechanism into the safeguarding team, for that to be reviewed and streamlined, and to include work with key partners and agencies to ensure that the referrals used and correct mechanisms and that referrals are accurately described and coded. The reason this came out of scrutiny was because there was some challenge from other agencies in relation to the referral mechanism. And at this time it was via email, and what was happening was that all the referrals in relation to safeguarding were going to the managers of all the services across adult care services for them to make a decision as to whether it fitted the criteria and the level for a safeguarding inquiry. And what was pulled out was actually there was a lack of consistency across managers across the whole of adult services. So I had a discussion with the director of adult care services, and a review was carried out in relation to the referral mechanism. But not just that, he carried out a full review in relation to the safeguarding referrals and the teams that were taking place and were dealing with the safeguarding referrals. As a result of that, they identified that actually there was a lack of consistency and there was concerns raised in relation to the referral mechanism. So adult care services have pulled together a individual group of people who are now specifically responsible for safeguarding inquiries in adult care services. They've recently carried out a review in relation to that. So that's been up and running now for just coming up for 2 years. There was some concerns in relation to staffing, and the Director of Adult Social Care has carried out a review for the safeguarding team. And part of that review, they've identified that there was insufficient staffing within the teams that have been identified. There's one over both sides of the county. So the review has been completed, and the result of that was that they have agreed to put money into the safeguarding team. A significant amount of money has been promised for the safeguarding team to be invested, and recruitment is currently underway for additional staff within that safeguarding team. And just an update from the report, 4 staff members have actually started a couple of weeks ago, so that's really good news. And the team itself is under constant review to make sure that it has the right amount of staff for able to prioritise all the referrals that come into it. So part of the review was also to look at an online portal. And if you're aware that the children's safeguarding team, they actually have all their safeguarding referrals completed by an online portal. And this was looked at by Adult Services and agreed that actually this was the best practice. So an online portal has been developed. That went live in 2019. And there's been significant work around the online portal, and there's numerous agencies are now carrying out that online portal. The Lister Hospital, Watford Hospital have adopted it, and the feedback is really good that the portal is working well. There's work now taking place in relation to the police for them to do their online portal, and also for the East Anglia Ambulance Service. Provider services are also using the online portal, and the feedback specifically from GPs has been very good, to say the portal is very easy to use and is working very well. The paper is going to Adult Care Services Management Board, and I believe next week actually, in relation to the portal, and for a decision to be made as to turning off the email system, so that every single safeguarding referral has to be made through the portal. Now I know Natalie wanted to touch on the impact of COVID and whether there was an impact. The online portal hasn't gone live for all services as expected due to COVID. However, as I've said, its meeting's going ahead next week in relation to how to progress that with the police and the ambulance service. And if there's any identified issues, then that's going to come to the board, and we're going to raise that to partner agencies. So did anyone want to ask any questions about the first recommendation, or would you like me to go through to the second one?
I think we will discuss and then vote on the first recommendation, and then we'll move on to the subsequent ones later. So,
okay.
Jane, your hand's up.
Thank you. Can I just ask, please, you've got the portal, and I assume you're also using email at the moment. Who is overall responsible to make sure that nothing falls through the gaps and gets missed?
So you have 2 safeguarding teams. The emails are reviewed by the safeguarding teams. The portal goes direct to the safeguarding teams. They have managers that review the emails. So you have the admin within the safeguarding teams. You also have the out of hours, which are constantly reviewed. So the email is reviewed constantly. There's a generic email, and the portal itself goes directly to the safeguarding teams as well as the emails. So nothing can miss, because that email is monitored by the safeguarding teams and their managers.
Thank you.
Can I just add that myself and Mary actually did a scrutiny check. So we did an assurance visit to the safeguarding teams probably about a year ago, Mary, just to make sure, because we were aware that the amount of referrals coming in was a lot. So I wanted to assure myself and the board that actually the team were working and that there was no referrals being missed. So we carried out a day assurance visit to the teams at in Farnham House, just to check what the systems were, how the referrals were coming in, how those referrals were being reviewed, and whether they were being, for me, it's the risk, harm and threat. So were they being looked at immediately, and were they being assessed as immediate, or what risk they were? And we assured ourselves that actually that was taking place.
Oh, great. Thanks very much.
Thank you. Nigel Quinton.
Yes, I think Jane's asked a similar question to the one I had. But if I understood you correctly, Liz, the reason for moving away from email is to establish greater consistency. Is that correct?
Yes, that's right.
Yeah. Is there an issue over accessibility for those that need the referral going through the portal, or is everything very, very straightforward?
No, it's very straightforward. It's a really straightforward form that you just need to fill in. So you literally just need to click on the link and fill the referral form. The issues that were identified by the police were in relation to double keying, because they've now got a police system called Athena, which isn't very easy to use. And I think the police have acknowledged that. So what's happening at the moment is that the Athena referral form is coming directly into adult social care, so it's going to the right team, but they're not using the portal, and that's the same for another service. However, that's what I said about it's going to the adult board next week in relation to making agencies use the portal, and if there's any issues that we have raised it at board, and it's something that we're working through, but that's the only reason. It's it's a lot easier form to fill in.
Okay, and the timing, because I mean this was started back in the end of 2019, wasn't it? Is there an issue over how long it's taken to get to where we are now, or is that purely down to COVID and other factors?
No, I think the issue in relation to the portal is the safeguarding team was developed first, so they were set up first. There were some issues in relation to recruitment of staff and retention of staff. Yeah. It was then identified that, and actually when all teams are set up, I think it was identified that there was not the right amount of staff within those teams. Mm-hmm. So it was always meant to be that actually the safeguarding teams would become live and would be embedded before the portal went live. So the portal hasn't been live for very long. It was the embedding of the safeguarding teams first, and then the next step was the portal.
Okay, thank you very much.
Thank you. I think Jonathan Kay, who is the chairman of the topic group, wishes to make a comment.
Thanks. Yes, I just wanted to add really that I very much welcome the 4 new staff that will specialise on safeguarding. I think that's very important, and that the fact that the portal is coming on stream now, and I think when it comes to the next review towards the end of this calendar year, hopefully we'll be able to see really how well that's working, and I would just like to pay credit to Liz, who's an excellent chair of this particular board. I mean, I've been on the review of the board, I think, for the last 3 years. And if anybody gets the opportunity to go to one of their board meetings and just witness how they work, they will, they won't fail to be impressed. So it seems to be moving in a good direction. So thank you, Chair.
Okay, thank you. I see no other people wishing to speak. So the recommendation is that this particular recommendation on the review and the streamlining of the services, recommendation that has been successfully completed. I'll go through each member in turn and ask them if they agree with that, and then we'll move on. So first of all, Councillor Chesterman.
Yeah, agreed.
Councillor Quinton.
Agreed.
Councillor Smith.
Agreed.
Councillor West.
Agreed.
Okay, so that's now been agreed. That will be confirmed in the chat by officers. So we can now move on. I'll ask Liz Hanlon if you can proceed with the second recommendation, please.
Of course, thank you. Okay, so the second recommendation was in communication, and it was embedding awareness and understanding of safeguarding is crucial in sustaining effective safeguarding of vulnerable adults. Hertfordshire Safeguarding Adults Board to instigate a tiered communication strategy that addresses and defines safeguarding and reflects the needs of frontline staff, specialists and counsellors. Progress and communication plan to be reported fully. So we carried out, after the scrutiny, we carried out a review in relation to the board's communication strategy, and part of that was to look at how we were communicating, who we were doing it to, and how could we make that communication easier and better to all to different varieties of people. So what we looked at was a tiered approach to raising awareness in relation to adult safeguarding, and we identified specific issues that we felt we needed to communicate. And over the last couple of years, those issues have been in relation to self-neglect and hoarding, and we're now moving on to cuckooing and modern slavery. So we're looking at how we can communicate. So we have, like I said, we have a good communication strategy. We communicate through frontline and specialist staff, and we also put communications out through to members of the public. We've used, and actually during lockdown, we've found that we've developed our communication even better during lockdown. So we've looked at how other ways can we put the message across to the members of the public in relation to looking out for vulnerable adults within their society, and that includes fraud that we all know has taken place, has increased quite dramatically through lockdown, but also domestic abuse. So we've used joined up working with police partners. We've used their OWL system, which is their online watch link network, and we've used that quite successfully. We've also carried out a campaign on our local bus routes. We've put out communications in relation to GP surgeries, dentist surgeries. We've also recently managed to recruit a lay member onto our public engagement group, and the lay member is a carer, so he's able to advise us on the types of communications that we should be putting out. So we've been doing lots of external communication. We've updated, our website has been completely revamped and developed, and there is a lot of information now on our website, and there's links from our website to other agencies. We've also, as part of my yearly self-assessment, so I go out to all agencies, including the 10 districts, and I carry out self-assessment visits once a year, and part of that I review their websites to make sure that they're linking into adult safeguarding, that their websites are highlighting adult safeguarding as a priority, but also that their websites are linked into our Safeguarding Adult Board website. So we've, like I say, we've done a great deal of work over the last year in relation to the communication. Happy for Mary, did you want to come in on that?
Oh yeah, just thank you, Liz. Yeah, just to echo what Liz said, I think it's developed significantly over the past year, and the impact of COVID has actually helped our communication strategy. I think this recommendation was really helpful because it made us look at this tiered approach and making sure that we were considering, communications across different groups of people. So our specialist and frontline staff, I think we were always fairly good with our communications, but just getting that view of how we communicate better with the general public and raising awareness, and as Liz said, particularly during COVID, the use of the OWL network was really helpful, and there was a massive reach by using that we wouldn't have been able to get to that many people in Hertfordshire before we had that set up. Really helped, and also the fact that members themselves wanted to be informed of what was going on with the safeguarding board, so we initiated having a regular information provided to members around what training offers there are, and how if they wish to attend, how they can do that. So yes, I think, as Liz said, it's worked really well. Thank you.
Okay, thank you very much, Liz and Mary. I've got Richard Smith wishes to make a comment. Richard.
Thank you very much. I think my answer's already been given by Mary, but Liz made remarks about the online watch link, and as a member I receive it myself, and I've been very impressed with the way it's covered so many difficult subjects, and take it from Mary because she just said it. And Liz, are you absolutely happy with the OWL system being used?
Yeah, I think it's been really good, and we've used it a lot more than we did. And our police partners have been really good in this. So we've put out, it's like I said, I raised the issues about domestic abuse, financial abuse, cuckooing, all the concerns that we had in relation to when we were locked down. That they have gone out via OWL, and we've had a good response from OWL, so that's been really good.
Okay, thank you very much. Now, Jonathan Kay, the chairman of the topic group, do you want to make some comment?
Yeah, I recall during the discussions we had about communications during the review, we talked about a telephone number, whether there ought to be a designated telephone number for people to ring if they've got any concerns about safeguarding. I can't remember whether there is one, or whether there ought to be one, or whether it ought to be promoted a little bit, more vigorously. I don't necessarily mean a sort of 111 or 112 type number, but has anything come of that, Liz? Perhaps you can just recall the discussion that we had at the time.
There is a designated safeguarding number which is on the website, and that will go through, so that's for out of hours as well, so that will go through the normal Serco system, which will then be referred, because not all, actually a very small minority of the referrals and the phone calls that come in are actually safeguarding concerns. So they'll go through the main portal, which will then be diverted as to where that safeguarding concern needs to be. But that's there, and that is on our website as well. And I don't think we've not developed another one, have we, Mary, at all?
No, and we have promoted that number through the various campaigns that we've done over the year. So it's well established.
Thank you.
Okay, thank you, Jonathan. I see no other hands raised, so we will move to the vote on the tiered communication strategy. So I'll ask each councillor in turn if they are happy to accept that this recommendation is completed. So I'll start with Councillor Chesterman.
Agreed, Chair.
Thank you. Councillor Quinton.
Agreed, Chair.
Thank you. Councillor Smith.
Agreed, Chairman.
And Councillor West.
Agreed.
Thank you. So that recommendation has been accepted as completed, and that confirmation will appear in the chat box. So if we can now move on to the third recommendation, which was on the relationships and the partnerships, as I understand it, with more collaboration and integration. So again, Elizabeth Hanlon, do you wish to talk to that?
Yes, please. So this third one was in relation to the transformation, sustainability and transformation partnerships that were just about to come into place around the time of the scrutiny. And actually, we have an annual development day once a year, which is all partner agencies attend, plus we open it up to wider agencies to make sure that we can find the full areas that we need to develop as a board and our priorities for a board. So we widened that out, and we had a presentation from the chair of the Hertfordshire and West Essex STP board, where presented us what the considerations were, what the impacts were going to be on the board, but also obviously multi-agency and partnership working, and any concerns that there might be in relation to joint working. So we had that initial presentation, and that was in November 2019, very soon after this the scrutiny. We then had an additional presentation following a review in March 2020 by Ian McBeath, who at that time was the joint chair of the STP board. And again, that was presented to the strategic leads. I'd say that actually the impact on the board and the impact on partner agencies has been very minimal. We have had a new representative from the CCGs. At the time, we had two CCGs representatives, one from East and one from West. We were concerned that when that went reduced to one, and the CC representative was also covering the West Essex side of it, that we would lose the impact, so the momentum for our board. However, I'm really pleased to say that that has not happened. So we have good board representation from the CCGs, and actually what's happening is that we are now linking and having more information in relation to West Essex and the way Hertfordshire borders West Essex, so Harlow areas, so the hospital of the borders, and actually the information coming out and being shared is really well received from partner agencies, and that's working really well. So the new board member has settled in very well. And what we've noticed, and actually the way it has worked so well, is that during COVID, I've pulled together fortnightly meetings with the statutory partners just to go through what risks are there in relation to COVID to their individual agency, but also what risks are those going to impact on partner agencies. And actually, again, we have found it really beneficial to have the CCG rep at those fortnightly meetings, looking not just at Hertfordshire, but across the borders as well, to identify, are there any risks from across the border, West Essex, that are going to impact on Hertfordshire. So those fortnightly meetings, strategic meetings in relation to COVID, have worked really well. And I'm pleased to say that we haven't had an impact on the board from the STPs at all. Mary, did you want to add any more at all on that?
No, just to echo what you said, Liz, from the functioning and the administration of the board's point of view, the impact of that change could have been quite significant, but it has worked really well. And as Liz said, the new board member is well settled in to our processes, and we've had no issues and no detrimental effects on our functioning.
Okay, thank you very much, Elizabeth and Mary. I don't see any hands raised, so I think everybody is satisfied with that. Jonathan, though, do you want to add anything to the comments made by the?
No, nothing to add, Chairman.
You're happy with that? Okay.
Yes, that's fine.
In that case, we can go straight to the vote again. So I will ask in turn each member if they're happy to sign this off. First of all, Councillor Chesterman.
Agreed, Chair.
Councillor Quinton.
Agreed, Chair.
Councillor Smith.
Yes, agreed. Very, very impressed.
And Councillor West.
Agreed. Thank you.
Thank you very much. So that recommendation has completion has been accepted, and that will appear in the chat box in due course. So I'd like to thank Elizabeth Hanlon and Mary Moroni for attending. Obviously, you can stay on if you wish to, but you're free to go now because we're going to move on to a completely different topic. But it's entirely up to you whether you stay or not. Thank you very much indeed for attending and for your reports.
Lovely. Thank you much for your time.
Thank you.
Bye. Okay, so we now move on to the next topic, which is Children in Care Council scrutiny of mental health and mental health of children in care topic group. The officers, I think, for that we have Nancy Berger and Marion Ingram. Is that correct? Present?
Yes, present.
Thank you.
And Nancy is.
Yes, present as well.
Okay, thank you. And Teresa Heritage was the executive member. I'm not sure if she's here. She doesn't appear to be here. Okay, so in that case, can we go now straight into the, just get my agenda together. Now, because the recommendation here is that there is a significant delay to the recommendations, perhaps rather than talk about each of these recommendations in turn, we might perhaps talk about about them collectively, or we'll vote individually. So I wonder if either Nancy Berg or if either Nancy Berg or Marian Ingram would like to make an opening statement about the whole range of issues that we're dealing with, given that we've got a delay, and why you want that delay to take place.
So, yes, I'm going to introduce it, and then Nancy's going to talk about some of the activities that have been carried out towards completing some of these actions. So the Children in Care Council, they actually carried out the scrutiny of officers and practice in regard to the mental health of children looked after and care leavers. And around about the same time that they were doing that, we had also commissioned an independent consultant to carry out a review of mental health services for children looked after. And one of the key recommendations that came out of that review was that we were going to recruit a 2-year programme manager whose focus would be the mental health of looked after children. And following the scrutiny, we actually extended that job title to the mental health of children looked after and care leavers, because there was a very strong voice from the young people that the mental health of care leavers was as important as the mental health of looked after children. So we had anticipated recruiting to that post during the spring of last year, and we had anticipated that post holder would be key in carrying out the recommendations arising from the CHIC scrutiny. And then we had COVID, and our mental health colleagues were very caught up in delivering an immediate COVID response. At the early help end of the mental health system, there's been an increase in activity over the last year. At the sort of tier 3 end of the mental health system across Hertfordshire, there has been a maintaining of activity, but at tier 4, clinical inpatient and children with really complex mental health needs, there's also been an increase in activity in Hertfordshire. So our mental health colleagues have been pretty much caught up with the business as usual, and were not able to engage in some of the developmental work that we would have wanted them to do. Similarly, our children's homes, we've had COVID in all our children's homes over the last year. We've had staff moving in to live with the children. We've had staff living in our children's homes for 7-day stretches at a time in order to promote consistency, continuity and well-being for children. So again, their focus has been very much business, maintaining, adapting and adjusting in order to maintain the way that they've been working. So, and again, our fostering service has been under huge pressure with COVID. We've had foster carer households shielding. We've had foster carer households with COVID. We've had foster carers who have family members who've died of COVID. So implementing a broader strategy that sits alongside the business as usual was very difficult, and we delayed recruiting to the post holder. However, we have now done that, and we've got somebody coming into post on the 1st of April, and they will lead on the implementation of these actions. But I did put a page on the front of the scrutiny recommendations because I didn't want you or the young people to think that we had done nothing from a service leadership point of view in terms of promoting the mental health and well-being of looked after children, as well as the mental health and well-being of all children. So there has been awareness raising with all our schools about mental health of children as they return. So we anticipate that the actual recommendations will start being implemented wholly as from April, and we look forward to bringing a report back in June, which has some more completed actions on it. And I will pass you over to Nancy now, who can tell you about some of the work that the Children in Care Council have been doing towards these recommendations. So over to you, Nancy.
Thank you. So for some of the work that we've been doing with our young people coming out of the CHIC Scrutiny, I mean, first of all, we had young people involved in recruitment of the programme leads. That was very positive. And with our younger group, aged 12 to 18, we've now engaged with the CAMS participation group, and we've met their participation worker, and we've got plans to get together, because obviously we've got lots of kind of shared interests, really. So that will be going ahead soon. And we're also involved in the CAMS review co-production task and finish group. So that's another way of making sure that our young people's voice is heard within that review. With the deputies group, we're also, and this was something in the report, making a film for schools about bullying and stigma. So if you're in care, what kind of bullying might there be around that? What kinds of things do young people hear? What's the stigma? Why is it wrong? How can young people cope with it? So we're working on making that film at the moment. And for our older group, the care leavers group, mental health issues very, very important to them. We are making wellbeing boxes with them at the moment, and we're also looking at what can workers do to really help a young person when they're going through a difficult time with their mental health. And we're working with the service to look at some standards about what workers can do. And we're also looking about what care leavers can do to help themselves when they're having a difficult period. So we'll be looking to put some resources together, useful apps, contact numbers, and that kind of thing.
So I hope that reassures the report, and Nancy's update reassures members that we are taking the matters that the young people raised seriously, and we are taking action to improve their mental health and well-being.
Okay, thank you very much, Marion and Nancy. So you're suggesting that the new staff member will start on the 1st of April.
Yeah.
And that there would be a sort of a narrative update on that in June.
Yeah.
And the recommendations will be delayed until September. The remaining recommendations will be delayed until September. That's your proposal.
For final sign-off, yes.
Okay, thank you. I've got Lynn Chesterman and Nigel Quinton who wish to speak, so I'll start with Lynn Chesterman.
Thank you, Chair. I totally agree that mental health is such a high thing on the agenda for all children, but particularly the children in our care. But I just wanted to ask, can you just explain to me the rationale between of the 2-year post? Is it because it's a fixed project, or is it a financial issue? Because I think that makes a difference to where we go with this. Thank you.
It is. When we conducted the review, we paid for that out of the CAMS transformation money, and we knew that we would not be able to implement it without additional capacity. So we knew that we would need a person to lead on the delivery of the outcomes of the review. We believe that that's a 2-year programme of work, and some of it is, so for example, our ARC model of supporting carers and supporting young people. We want to set up a board to look at fidelity. We want to get the training. We want to get it more consistent. And we felt that within 2 years, that piece of work would be embedded. We also know that the government is taking a lot more interest in the mental health of looked after children and care leavers. And we're sort of a bit watching this space because we think that there is a possibility that the government may require us to have a post similar to the virtual school head. So the virtual school head was created in order to improve educational outcomes for looked after children. And we think, and I don't know whether COVID will impact on this, but because there were a few reports coming out from central government, the Department for Education, around the mental health and wellbeing of children, looked after children, we thought that the government might mandate such a post, in which case we would have to find the money to continue funding it further. So we're reviewing our position sort of a year, 18 months into the post.
Thank you. Nigel Quinton.
Thanks, Chair, and thanks for the update. I actually attended the CHIC Scrutiny last February as an observer. I found it fascinating, very interesting, somewhat concerning, hearing some of the reports from the children looked after about their experiences, but also very encouraging in what I was hearing about a lot of the initiatives that were taking place, which were, I think, on the whole, very welcome, and by the children as well. My concern, though, is that we've effectively lost a year, and I really do not understand why this was not prioritised rather than pushed back in response to COVID. We know the mental health pressures that COVID has landed on all of us, I include myself in that. But particularly on young people. So the decision to delay that recruitment, I find very hard to understand. I wonder if you could just fill us in on that.
So we were also recruiting, there is a lot of other work going on within the child and adolescent mental health agenda, and we were also recruiting to a 2-year post a programme manager on system redesign, CAMS system redesign. And we felt that trying to recruit 2 people of good quality at the same time wasn't going to be something that was deliverable, because so many of our mental health colleagues were caught up in activity that meant they couldn't look outwards, they were just looking down. And we prioritised the programme manager for the system redesign because it potentially impacts on more children. So I know these are our children, and I think that's why I was very keen to attach the cover report, because I know it's not normal practice to do that. But I did want to reassure elected members that we have been doing a lot of work. So, for example, the issue about the therapeutic approaches and choice, what we saw in the children in the scrutiny was that in some children's homes you had that wider therapeutic approach, in other children's homes you didn't. We have been rolling some of the alternative methods out across our other children's homes. We have been strengthening the ARC model of intervention. We have got a full-time trainer. We've also opened up some new children's homes, and some of those broader therapeutic approaches have been embedded in those 2 new children's homes before they've even opened. It's just we haven't got to a point of being able to say it's done. I think the issue about the mental health in schools and the work on the work that Nancy mentioned, the bullying film, I think we have been supporting the schools in dealing with the mental health of looked after children. No, of children, because it's become a much broader issue. So the virtual school, as I said in my note, they have still been rolling out their attachment aware toolkit. They have been working with schools. We've been providing lots of emotional support to foster carers about how they get children into school. So it's not that we haven't been doing anything, it's that we haven't got any of these activities to the point where I would want to say, okay, that recommendation is now complete. I don't think it will take us long to get there because we have been doing activity. So, and the post, like I say, we didn't feel we could go for 2 at the same time. And the work on the CAM system redesign, which is about making sure that everybody knows what support is available to whom, will benefit looked after children in the same way that it will benefit other children. The increased support at an early help time in terms of need will benefit looked after children in the same way that it will benefit other children. The development of the website, the development of a digital front door to our CAM services, that will all benefit looked after children as well as other children. And that's the programme manager that we recruited probably about 5 months ago. And that work is making good progress.
Thank you. I mean, I made a lot of notes of that scrutiny. I've just managed to find them. I thought I'd lost them, but I did manage to find them. And I mean, one of the main concerns, and I think it actually feeds into what you just said, was a lot of young people refusing to use CAMS because they, quote, didn't like it. So I think, you know, you're right to prioritise the system review of CAMS. I am disappointed, though, that we aren't able to recruit more than one person in a year. From the outside, that looks odd, but
yes, we haven't we haven't only recruited. They are senior posts. Yeah. There isn't a good range of people who's applying for our senior posts. Mm-hmm. And that's not just a Hertfordshire issue, that's a national issue. Yeah. We have taken 2 people from Hertfordshire actually into both these posts, which has left gaps behind them, because even though they were both advertised externally, we didn't get any external applicants for these posts. And yes, but now that we have got somebody, it will be really good to have that focus. Yeah. And I think we didn't want to reduce the possible list of applicants.
Okay, thank you. That's helpful.
Okay, thank you. I've got Jane West would like to make a comment, but also Natalie. Natalie, do you want to make a comment specifically about Nigel Quinton's remarks, or is that something else?
I think it's just to remind Isaac that the recommendation was not about the appointment of a programme manager. That was a service decision in response to the recommendation. This first recommendation was about reporting back to the CHIC Council to ensure that they were kept briefed of what was happening.
Okay, thank you, Natalie. So Jane West, please.
I'm not sure that I should be asking this question here, but could I just ask, in the past year, you've obviously had care leavers. Can I just ask how you've managed to deal with that over the last 12 months?
So we've allowed young people to stay in their placement longer in semi-independent provision where they've been due to leave at 18 and it has not been appropriate for them to leave. They've stayed in their placements. The Leaving Care Service has we moved a lot of our contact with young people onto WhatsApp. So during the lockdown periods, we've had less face-to-face contact, although we've continued to have some face-to-face contact with everybody. The care leavers were having weekly contact from their leaving care PAs, to the point that some young people actually said, will you get off my case and stop contacting me so often? We have all young people who didn't have access to technology were given laptops, and young people who didn't have access to data were given routers. Mind set up a special, I forgot to write this in the report actually, Mind set up a special care leavers helpline in Hertfordshire for our young people. So, and I think the most important thing actually was that we didn't make them move if they weren't ready to move, which did incur costs to the local authority, but they were met and there was no quibbling about that. So, and we maintained a much higher level of contact than usual, as well as ensuring that they could have contact.
Thanks, Marion.
Okay, thank you, Jane. So I think there are no more hands raised, so I think we can now move to the votes on the recommendations. I think, although we've had a discussion about these collectively, and I think to some extent they're all the same issue, I think for the record we'll have to vote on them individually. So first of all, if you go to recommendation 211, which is to agree an extension till June 2021 of that particular recommendation. So again, I'll go through each member in turn. Will you say whether you agree or not with that? So Councillor Chesterman.
If that is a timeline that can be met, I agree. Thank you.
Councillor Quinton.
Yes, from the same point of view, we are where we are, so I think that's probably the earliest it can be met, isn't it?
Councillor Smith.
Agreed.
Councillor West.
Yeah, I agree.
Thank you. So that recommendation has been agreed. So if we can now, and that will appear in the chat box, if we can now move to recommendation 212, which is proposed to delay until September 2021. Councillor Chesterman.
I think, as before, yes, as Nigel says, we are where we are. So, yes, agreed.
Thank you. Councillor Quinton.
Yes, agreed.
Councillor Smith.
Agreed.
Councillor West.
Agreed.
Thank you. So that recommendation has been agreed and that will appear in the chat box. So if we go to recommendation 213, which is also to be delayed until September, Councillor Chesterman.
Agreed.
Councillor Quinton.
Agreed.
Councillor Smith.
Agreed.
And Councillor West.
Agreed.
Agreed. Thank you. So that agreement will be in the chat box soon. We go to recommendation 2.1.4, which is also being delayed. It's proposed to be delayed until September. Councillor Chesterman.
Agreed.
Councillor Quinton.
Agreed.
Councillor Smith.
Agreed.
And Councillor West.
Agreed.
Thank you. So that agreement will soon appear in the chat box. And finally, recommendation 2.1.5, again to be delayed until September. Councillor Chesterman.
Agreed.
Councillor Quinton.
Agreed.
Councillor Smith.
Agreed.
And Councillor West.
Agreed.
Okay, thank you very much for everybody. So that recommendation has also been agreed. So those will be delayed until June or September as appropriate. So thank you very much, Marion Ingram and Nancy Berger, for attending and for giving us your report. And we look forward, or the next committee will look forward to meeting you again next June.
Thank you.
Thank you very much indeed.
Bye.
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 Bye. Okay, so that now completes the two reports on topic groups. So we now move forward to the forward plan, which is in the agenda. So again, we are only asked to note that. Do anybody have any comments on that forward plan before we go to a vote on voting it? No, I see no hands raised. So again, I'll go through one by one and ask you to say that you agree to note the forward plan. So Councillor Chesterman.
Agreed.
Councillor Quinton.
Agreed. It just occurred to me is why do we not have any dates beyond this meeting already in the diary for things to come in back to ISAC on for the ones that have already taken place?
That's because the council has not yet agreed the dates for meetings post-COVID. That's a simple one.
Very simple answer. Thank you, Natalie.
Yeah, a nice straightforward one. Thank you, Nigel.
Well done, Natalie.
Agreed.
Okay, Councillor Smith.
Agreed.
And Councillor West.
Agreed.
Thank you. So we've all noted the forward plan. So that effectively brings us to the end of the meeting. This is the last meeting before the election. So the meeting in June will be completely different people. So I'd like to thank everybody for attending these meetings. Thank you for the councillors for attending. Thank you also to the officers, Natalie, Teresa, Fiona and Michelle, the scrutiny officers, for all the support they've given us and particularly me over the last last year or so. So I'm very grateful for them. One thing I would like to have noted, though, is that since it will be a completely different committee after the election in June, I wonder whether we shouldn't recommend in our notes that the new committee should have some kind of a briefing or training session.
Definitely.
In advance to that, so they can have a clear clear idea of how it should proceed.
Definitely, Chairman.
I see a lot of agreement to that.
Yeah.
And also, we had no health scrutiny items today, but I suspect that in June there might well be some health scrutiny items coming forward. Okay, and there's no other business, so I call the meeting to an end then at 5 minutes past 11. Thank you, everyone. Thank you very much, everybody.
Thank you.
Thank you.
Thank you.
Bye-bye.
Thank you, everybody.
Bye, everyone.
Bye.
Bye now.